I just wanted to say, while Ayla was talking, I think of some of the clients we've had over the years that they come in with headaches or irritability or depression, severe depression or aggression or whatever that may be. And on our intake, it's like past traumas. And they'll go, well, how does that car accident 20 years ago, where I went through the windshield, has to do with my problem today? Whether it's back pain, whether it's this migraine or headache, but traumas, whether it's 20 years, 30 years, 40 years before, they start to put the pieces of the puzzle together, because we look at the body and you can see the patterns in the body, the dysfunction in the body correlates with their history, And I think it's important to know, I remember treating many, many years ago an NFL football player. He was at the Super Bowl, and the guy was 63. It was a mess. But they weren't talking about that 20 years ago, TBIs. And you look at the football players that have committed suicide, who would have related suicide to these TBIs? So they started collecting this information, and that's one point I think is really important to say. It's more than just sports. It's the baby who, I believe that every baby should have their head checked and their body checked before they're released from the hospital, because a lot of these kids have dysfunctions that could be treated. But, or you have the patient that has had headaches always. They can't remember not having a headache. Well, maybe it was an early injury. Think of the kids that fall down the stairs, or they go down the front 2 stairs and land on the cement and they get the goose egg, or when they used to have those walkers, thank goodness they outlawed them, and the kids would fall down the stairs with the walkers. They don't remember that when they come in. They're now 30 years old, 40 years old. They don't remember they fell down the stairs and landed on their head. Parents are gone, don't even make that connection. But it's these previous injuries that can be causing a lot of these signs and symptoms years later. So you have the acute concussion that's getting a lot of attention, but as Bess was saying about her sibling, there could be a history of concussion or multiple concussions that have led them to these signs and symptoms.